You know that stubborn nagging ache, maybe it's in your shoulder, your elbow, your heel, that just won't go away. We have all been there and you have probably called it tendinitis. But what if I told you that word, that simple label is probably wrong? And what if that misunderstanding is actually getting in the way you getting better? So let's get right to it. We have been trained our whole life to think that pain equals inflammation, right? And what do? We grab the ice pack, pop some anti-inflammatory pills and hope for the best. But for that chronic nagging tendon pain, the kind that flares up every time you get active, the real problem is very likely something else entirely. Okay, let's break down the word itself. Tendinitis. See that itis at the end. In medical speak, that suffix literally means inflammation. And sure, inflammation can definitely be a factor, especially right after a new injury. But what the science is telling you loud and clear is that for most long term overuse injuries, significant inflammation just is not there. The word we are all using is frankly a bit of misnomer. So if it is not tendinitis, what should we be calling it? Well, there is a much better, much more accurate term that clinicians can and researchers use, and it's time we all got on the same page. And that term is tendinopathy. Just think of it as a big, all encompassing umbrella that covers pretty much any painful tendon issues caused by doing too much. The beauty of this word is that it doesn't assume inflammation. Instead, it focuses on what's really going on. You have got pain, you can't perform as well, and the tendon itself is physically changing. Now this is where it gets really fascinating, because the tendon doesn't just go from perfectly healthy one day to injured the next. It's journey, a process that happens over time when a tendon is overloaded, and it unfolds in some pretty distinct stages. Exactly, it's not an on-off switch, it's a spectrum, a continuum of change. And understanding this is so important because it explains why your pain might feel different day to day and why getting better is almost never a straight line. So let's walk through this journey. It all starts with stage 1, reactive tendinopathy. This is your body's early warning system. You have done too much too soon, and the tendon temporarily thickens and gets angry as a protective measure. The good news, at this stage, it's totally reversible if you back off and manage the load. But if you don't listen and keep pushing through the pain, you slide into stage 2, tendon disrepair. Now the tendon is trying to heal, but it can't keep up. The structure starts to get disorganized. Think of a rope that's beginning to fray. And if this goes on for a long time, you can end up in stage 3, degenerative tendinopathy. This is where the tendon's structure is really breaking down. The collagen is compromised, cells may be weaker and more vulnerable to a serious tear. When you go to a doctor for PT, you might hear a whole bunch of different terms. It can get confusing, so let's quickly decode the doctor speak so you know exactly what they mean. This is the big one, tendinitis. True inflammation, and it's less common than you think in chronic cases. The term you really need to know is tendinosis. See that osis. That means degeneration or an abnormal condition. This is the frayed rope, the long-term breakdown of the tendon's collagen structure, and crucially, it happens without much inflammation. For most people with stubborn tennis elbow or Achilles pain, this is what actually happening. And sometimes the pain is not coming from the tendon fibers themselves, but from the issues around them. Some tendons, like in your wrist, have a slick little sleeve called a synovial sheath to help them glide. When the sheath gets inflamed, we call it tenosynovitis. Other tendons like the Achilles don't have a sheath but have tissue around them. If that gets irritated, it's called paratendinitis. The point is, the neighborhood around the tendon can be the source of pain too. Okay, there is a great theory is great, but let's make this super practical. How do you know connect all this to what you are really feeling in your own body? What are the classic signs and where do these things usually show up? Do any of these ring a bell? Do any of these ring a bell? The number one sign is pain that gets worse when you use it. You try to run and that Achilles just screams at you. It often feels stiff first thing in the morning. You can probably poke around and find a specific spot that's super tender. You might even feel a little thickening or a lump in that area, and sometimes you may get a weird cracking sound. These all are the classic signs. Now, where do we usually see this? In the upper body, the rotator cuff in the shoulder is a big one. That pain when you reach overhead. There's the famous tennis elbow pain on outside of your elbow when you grip something. It's cousin golfer's elbow. Is the same thing but on the inside. And that sharp pain you get at the base of your thumb, that could be the decurvein's tenosynovitis. Then in your lower body, you have got The two heavy hitters, the Achilles tendon, a huge hotspot for runners, usually a couple of inches above the heel, and the patellar tendon right below the kneecap. Anyone who plays a jumping sport knows this one. Jumper's knee, that sharp pain when you land or even just walk downstairs. So who gets this stiff? We all, as you can see, the number one reason by far is training error, a sudden jump in how much you are doing or how hard you are going. It's weakened warrior who decides to run a 10 kilometer after not running for 6 months. Of course, any repetitive activity, whether from sports or your job, puts you at risk. And yeah, unfortunately, as we get older, our tendons just are not as resilient as they should be. Okay, I have to pause for a second because this is incredibly important. Everything we have talked about is that gradual nagging ache, but if you ever feel a sudden sharp pain, maybe you even hear or feel a pop, and you instantly lose the ability to use that muscle, that is massive red flag. That's not tendinopathy. That's very likely to full tendon rupture, and you need to get it checked by a doctor right away. So let's bring that all home. After everything we have covered, what is the single most important idea you should walk away with? It's about changing your entire mindset about why your tendon hurts. Here it is. The pain you are feeling is not just some random annoying inflammation. It's signal, direct communication from your tendon telling you that the amount of load you are putting on it is more than its current capacity. That's it. It's a mismatch between what you are asking to do it and what it's strong enough to do right now. And that leaves one final crucial question. Your body is giving you data. That pain is valuable feedback. So are you treating that signal like noise that needs to be silenced with a pill? Or are you treating it like the critical information it is? Is your training plan, is your life actually listening to what your body is trying to tell you? Thank you.